Today I'm talking about Medicare for 2019, premiums, deductibles, and the basics that you need to know, especially if you're first turning 65. So stick around.
Stick around.
So let's just start off by reviewing the Medicare basics that you need to know for 2019. So let's talk a little bit about your Medicare enrollment. Now, most people that are going to be turning 65 will be eligible for Medicare the first day of their birth month. So if your birthday is March 15th, you will be eligible for Medicare starting March 1st. The only exception to this rule is for people born on the first of the month. And their effective date for Medicare is actually the first day of the month prior. So for someone born on March 1st, their Medicare effective date would actually be February 1st. Now, how and when to get signed up for Medicare is an important question. Your Medicare enrollment period begins up to 3 months before the month that you turn 65, and it goes up to 3 months after your birth month. So you can sign up for Medicare anytime up to 3 months before the month you turn 65 and up to 3 months after the month that you turn 65. If you're collecting Social Security benefits and you've been collecting Social Security benefits for at least 4 months before you turn 65, you actually don't have to do anything to get set up on Medicare at age 65. You'll automatically be enrolled in Original Medicare Parts A and B, of course, effective the first day of your birth month. If you're not collecting Social Security benefits, then you do have to enroll in Medicare in order to avoid a penalty, a late enrollment penalty. And there's a few different ways that you can enroll in Medicare. Now, the easiest way, in my opinion, is to enroll online. And I'm going to link a video above here that's going to tell you exactly how you can sign up for Medicare online. It'll walk you through it step by step, but you go to ssa.gov. It's a pretty straightforward process. Some people are not going to be able to enroll online. For example, if you were born out of the country or Social Security has some different information in their system about you, then every once in a while there will be an error and you may have to actually go down to your local Social Security office to enroll. But for most folks that are going to be turning 65, they can easily sign up for Medicare online. The other options for enrolling in Medicare are calling Social Security or just going on down to your local Social Security office. That's not usually the most fun way, but that is another option that you have to get enrolled in Medicare. So when we're talking about Original Medicare, we're really talking about Medicare Part A and Medicare Part B. And it's important to know what Part A and B covers and what the out-of-pocket costs are for you. So Medicare Part A is your hospital insurance. And this is the part of Medicare that helps to cover your inpatient hospital stays, your skilled nursing facility care, some home health care and hospice care is also covered under Medicare Part A. And Medicare Part A is usually free as long as you've been working in the United States for about 10 years or about 40 quarters and you've paid into Medicare for that long, then you usually get Medicare Part A for free when you turn 65. And it's kind of automatic when you turn 65, whether you're collecting Social Security benefits or not. Part A is usually free and automatic for most folks. Medicare Part B is your medical insurance. And this is the part of Medicare that covers your doctor's office visits, anything outpatient outside of the hospital setting, like outpatient procedures, physical therapy, durable medical equipment, ambulance, diagnostic testing, all of that good stuff is covered under Medicare Part B. Medicare Part B is not free. Most people pay a standard monthly premium of $135 a month to be on Medicare Part B. Now, if you're collecting Social Security benefits, this premium is automatically taken right out of your Social Security check. monthly. And if not, then Medicare will bill you for your Medicare Part B premium. It's important to note that usually your first bill for Part B is a quarterly bill. So if you get a bill for, $400, beware that that's a quarterly bill for Medicare Part B, and you can set up payments directly with Medicare, whether you want to do an automatic monthly bank draft or you want to mail them in payments. You can set that up directly with Medicare when you receive your first Medicare Part B premium bill. Now, some people will pay more for Medicare Part B. It's going to depend on your income. So the government's going to look back at your most recently filed tax return to determine what your Medicare Part B premium is. Now, most people pay $135.50. That's the standard Part B premium. But depending on where you fall in these income brackets, you may pay more. So this is the 2019 income-related monthly adjusted amount chart for Medicare Part B that shows you what you can expect to pay based on your income. So we talked a little bit about Medicare Part A and Part B and what it covers. Now, what are the out-of-pocket costs associated with Medicare Parts A and B? Because while it helps to cover your doctor and hospital stuff, it doesn't cover everything at 100%. When it comes to Medicare Part A, your inpatient hospital coverage, you have a $1,364 deductible for an inpatient hospital stay. And this deductible is per 60-day benefit period. So it's not an annual deductible. It's a deductible that will renew every 60 days. If you have an extended stay in the hospital past 60 days, you will have to pay $341 per day for days 61 through 90. And if you're in the hospital past 90 days, you will pay $682 per day. If you have skilled nursing facility care, you're going to be covered at 100% for the first 20 days by Medicare Part A. But then after that, you'll have to pay $170.50 per day for days 21 through 100. For Medicare Part B, your medical coverage, there's an annual deductible that you have to pay. It's $185 this year. And then after that, everything's 80-20. Essentially, Medicare is going to pay 80% of all of your Medicare Part B services, and you're going to pay 20%. So these out-of-pocket costs can be pretty high, and that's why most people look at doing something else in addition to original Medicare to kind of help protect themselves against those potentially high out-of-pocket medical costs. So when you're on original Medicare, there's essentially two main options on how you can get your coverage. This is a nice little flow chart that kind of shows you which paths you can take. So you see here, there's kind of like, a fork in the road, and you're deciding whether you want to go right or whether you want to go left. And that is going to determine how you receive your Medicare benefits. So let's start off by talking about this first path over here, which is going to be keeping original Medicare as your primary insurance. Okay, so Part A and Part B is your primary insurance. The government program Medicare is your primary insurance. And then you decide if you need to add on a Medicare Part D prescription drug plan to cover your medications. Most people will need to add on a Part D drug plan. And then you'll decide if you want to add on a Medicare Supplement, also called a Medigap plan. Now, Medicare Supplement or Medigap plans are designed to fill in the gaps in Parts A and B. So they pay those deductibles, that co-insurance that we just talked about that original Medicare doesn't pay. If you decide to go this route or this path, then you can go to any doctor you want. Really, that's one of the benefits of it, because original Medicare is your primary insurance, so there's no networks. So you can always go to any doctor, no referrals needed, really anywhere in the country, as long as your doctor accepts Medicare patients. Most doctors and hospitals do. You also have very complete health coverage if you go this route, because these Medicare supplement plans are going to really pay most of those out-of-pocket costs associated with original Medicare. So in turn, you're left with little to no medical bills if you get sick, if you go to the doctor, if you go to the hospital. Now, the downside of this path is that obviously it's going to be a little bit more expensive because you do have to purchase a separate Medicare Supplement Plan, and you also have to purchase usually a separate Medicare Part D prescription drug plan. So you have some additional monthly premium costs that you're paying in addition to your Medicare Part B premium. Now, this other path that I want to talk about is called Medicare Part C, and it's also known as Medicare Advantage. Now, Medicare Advantage plans are managed care plans that have been approved by Medicare. They combine the benefits of Part A, Part B, and they usually include Part D prescription drug benefits rolled right into the plan. Now, you do have to continue to pay your Medicare Part B premium in general, whether you go down this path or the other path. You have to be enrolled in Medicare Part B, which means you have to keep paying your Medicare Part B premium. But if you choose to do a Medicare Advantage plan or Medicare Part C, you're essentially choosing a managed care plan that's going to replace your original Medicare benefits. So now instead of having original Medicare as your primary insurance, you have your Medicare Advantage plan as your primary insurance. So, lots of different companies offer Medicare Advantage plans, some of the more popular ones being United Healthcare, Aetna, Humana. So if you're on this path, original Medicare is your primary insurance. If you're on this path, then you have Aetna or Humana or United Healthcare or whoever as your primary insurance. Medicare Advantage plans are a good fit for some people because they are very low cost. In many areas of the country, you can get a Medicare Advantage plan for $0 a month, and it does include prescription drug coverage usually. The downside to these plans are that they do require you to use network providers usually. So the plans will be HMO or PPO. They will have a set network of doctors and hospitals that you generally have to use or will want to use to lower your out-of-pocket costs. With a Medicare Advantage plan, you're going to have a set dollar amount assigned to every Medicare covered service. So things like doctor's office visits, hospital stays, ambulance rides, etc., all have a set dollar amount or a set copay associated. And then you're going to pay those dollar amounts for your medical services until you've met your Medicare Advantage plans out-of-pocket maximum for the year. Most Medicare Advantage plans have an out-of-pocket maximum of around $6,700 per year in 2019. So there's definitely pros and cons to each of these paths, and the one that you're going to go down is really going to depend on your specific needs. The one thing that you do want to know if you're turning 65 for the first time is that you do only get one open enrollment period for Medicare Supplement insurance. Now, these Medicare Supplement plans or Medigap plans are generally medically underwritten plans. So typically you have to answer a bunch of health questions to qualify for these types of plans, except when you're first turning 65 or you're first going on to Medicare Part B. Then you can get any Medicare supplement plan you'd like, no health questions asked. And for Medicare Advantage plans, there's never really medical underwriting there. They will ask you if you have end-stage renal disease, and that would be the only health question that could potentially be a disqualifier for Medicare Advantage, but there's generally no health questions there. And there is an annual open enrollment period for Medicare Advantage that happens every fall. So that's something that people ask me a lot. Well, can I switch from one plan to another? If I start here, can I go here? Can I switch down the road? The answer is that if you're here, you can generally always go here to Medicare Advantage because there's not really going to be that medical underwriting, and there is the opportunity every fall to get on an Advantage plan. If you start with an Advantage plan, can you go here? Well, maybe. It's going to depend on your health and if you can pass through the medical underwriting to get that Medicare Supplement Plan. If you are thinking about doing a Medicare Supplement Plan, this is kind of the big confusing chart that tells you about the different Medicare supplement plans that are available. There's a lot to look at here, but really what I tell people is that essentially there's only 3 or 4 plans that people really ever choose that really make sense to choose when you look at the cost versus the benefit of that plan. And those are plans F, G, and N. And I'm just going to talk about these plans really briefly. I'm going to link to another video up here where we go in more depth about these plans. But Plan F is the plan that has historically been the most popular because, as you see here, it's the one that covers all of the gaps really in Medicare Part A and B. It pays 100% of everything. So if you go with original Medicare and you add a Plan F, you pay nothing really out of pocket at the doctor or hospital. There's going to be no copays, no deductibles, but you're paying a lot higher monthly premium for that plan because it does offer first dollar coverage. Plan F is not going to be available to any newly eligible Medicare beneficiaries after the year 2020. If you have a Plan F now, you will be able to keep it forever. Medicare supplement plans are guaranteed renewable for life. However, just to let you know, after 2020, Plan F will no longer be available to people that are newly turning 65. Plan G is very similar to Plan F. It's almost the same. The only thing it doesn't cover is the Medicare Part B deductible. If you remember, we spoke about that. It's a $185 annual deductible. Plan F pays it, Plan G doesn't. So if you get a Plan G, you will have to pay the first $185 of your medical expenses. And then after that, the plan pays 100% of everything else. There's no other copays or coinsurance or out-of-pocket costs associated. Plan N is another really popular plan, growing in popularity. It's very similar to Plan G. It also does not pay the Medicare Part B deductible, so you'll pay the first $185 of your medical bills. And then with Plan N, if you see these 2 little stars here under the Medicare Part B coinsurance or copayment, Plan N does require you to potentially pay copays at the doctor's office and at the emergency room. So even after you've met your deductible, you'll still be paying copays possibly of up to $20 at the doctor. It's up to the doctor how much they want to charge you, or up to $50 at the emergency room. Plan N also does not cover Medicare Part B excess charges. These are very rare. You don't come by them very often, but Part B excess charges can happen if you go to a doctor that does not accept Medicare's payment as payment in full. They can technically bill you up to 15% above the Medicare approved amount for that visit or that service. Those would be excess charges. Again, they're incredibly rare. Most doctors accept Medicare as payment in full. And in some states, excess charges are even illegal. But it is something to be aware of with Plan N, doesn't cover those excess charges. So just to kind of recap for people turning 65, you do have that really big choice of deciding whether you want to go with a Medicare Advantage plan or a Medicare Supplement plan. And I've listed just a few of the bullet points that I think you really need to know about making that important choice. Medicare Advantage plans are, again, managed care plans, alternatives to original Medicare. They usually include Part D prescription drug plan benefits. They have networks of doctors and hospitals. Your benefits can change annually. So copays, coinsurance amounts, monthly premiums can change from year to year. These types of plans do generally have lower monthly premiums, some as low as $0 a month. You're going to pay copays and coinsurance for most services if you get sick, if you go to the doctor, if you go to the hospital. And some Medicare Advantage plans even include limited dental and vision benefits all rolled into that plan. Medicare Supplement plans, on the other hand, are private insurance plans, and they're designed to supplement original Medicare. These plans keep original Medicare as your primary insurance, so the supplement plan is your secondary. There's no networks. No matter what type of supplement plan you have, you can always see any Medicare provider anywhere in the country. These plans also travel with you. So whether you move or you're visiting another state, you do have coverage nationwide. Whereas with Medicare Advantage plans, they're typically going to be regional plans where you have coverage in your area. Medicare supplement plans do not include Part D prescription drug plans. There's no Medicare supplement plans anymore that include drug coverage. So you will have to purchase a separate standalone Medicare Part D prescription drug plan to go along with your coverage. Now, whether you're choosing a Medicare Advantage plan or a Medicare supplement plan, your options, your pricing, it's really going to depend on your area. So what you want to do is you want to speak to an independent broker. I talk to folks all the time that try calling up different insurance companies. Sometimes they even get misinformation about the Medicare system itself. So I would highly recommend seeking out an independent Medicare broker that can really help answer your questions, give you quotes and price comparisons and plan benefit comparisons for all of these different options that you now have available to you as a Medicare beneficiary. I would, of course, be more than happy to help. You can feel free to give me a call at any time, send me an email. And I work with both Medicare Supplement and Medicare Advantage plans in most states in the country. So I'm more than happy to provide any information that you need. Quotes are always completely free. There's no obligation, and we do not sell your information. So if you want to give me a call or shoot me an email, your information will never be shared with anyone else. Thank you so much for watching the Medicare Basics for 2019. I hope that this information helped. Feel free to like this video, comment below with questions, and subscribe so that you can keep seeing more Medicare informational videos like this. Thanks again for watching, and we'll see you soon.